Good afternoon, guys. Just wanted to hop on real quick and share something that took place this week at work. It's a little bit of a departure from my kind of caregiver information series of videos. And what I wanted to share with you was a situation involving a patient that highlights some of the problems and challenges that we have as clinicians in the hospital, that you may run into as caregivers or family members of loved ones that are in the hospital, or if you yourself are in the hospital. And I may get a little cranked up about this one because it was pretty frustrating to watch an elderly gentleman be treated this way. And he wasn't mistreated to his face. It was just a failure of the system at large to care for him in a way that I thought was adequate. Now, I know my opinion is just that, is my opinion, but let me share the scenario and then you guys can be the judge. So, gentleman in his late 70s comes in, and he had fallen at home, and he lives by himself. He was found at home and brought to the hospital after the fall. As the testing and imaging was performed, they found that he had a fracture in his neck and also a fracture at the base of his skull where his spine meets his neck. Meets the back of his head. And so, in finding that, he obviously gets all the appropriate consults for the neurosurgeons and so on. They have him in a hard collar to protect his neck and so on. Once the neurosurgeon did his consultation, they determined that they were going to treat the fracture non-operatively, which that's par for the course, depending on the nature of the fracture. And they were going to treat him conservatively with a hard C-collar, cervical collar, at all times to allow stability of the neck to take place so that healing can happen. And so he's at less of a risk for the fracture to get worse. During our multidisciplinary rounds, which is kind of a meeting that we all have on any given floor of the hospital that involves the doctor, the nurse, and other members of the care team, and we all get to weigh in on patients and any barriers or issues we see to their discharge. And so it came around to this patient, and the nurse advocated for that patient to have a therapy consult. Now, it seems like a therapy consult would be a no-brainer for a patient who fell at home and has sustained a fracture. Nonetheless, had to ask for it, got it. I went and did the consult, and this gentleman was very, very weak, very weak. He needed significant assistance to sit up on the side of the bed. He could not stand up from the bed without my help, and he had existing left-sided weakness from a stroke that he had had in the past. And this current fall and injury that he had served to make the left-sided weakness worse or more prominent. And so he had, I think he could only walk about 20 feet with moderate assistance. So it seemed pretty straightforward to me. This gentleman, he fell at home. He had sustained some injuries. His current level of mobility is not great at all, and is certainly not conducive to be living at home alone, which is what his prior level of function was. He was living at home by himself. Now, should he have been at home by himself to begin with? That's debatable. But that aside, this gentleman now presents with a certain set of issues and impairments that indicate clearly to me that he is not safe to go home. So after that session, after my evaluation, I sit him in the chair to get him out of the bed, and he sits up for a good portion of the day. Later on that afternoon, the nurse calls me and says, "Hey, we have an issue with this gentleman." I said, "Well, what happened?" She said the case manager or social worker team went in and they started talking to him about going somewhere to get rehab before he goes home, and he became absolutely beside himself. He was irate at the mentioning of him going anywhere but home. which I thought was odd because when I saw him earlier that morning, he was completely open to it and thought it was a good idea because of him having fallen at home. Well, as I asked more questions to the nurse regarding the situation of him becoming agitated and very upset and frustrated and somewhat belligerent, she mentioned that he's taking his cervical collar off. He slid himself out of the chair onto the floor, and I thought to myself, this sounds like he may be confused, or his mentation may be altered for one reason or the other. And as I questioned her about this and was getting information about the event, she said, yeah, he thought that we weren't even there. He thought that we were trying to send him somewhere to be kept forever, and so on and so forth. And that was clear to me at that time that this gentleman was not in the right state of mind. Well, the case management and social work team at that particular time took his refusal to go to rehab as being a legitimate refusal. And to me, that was an unfortunate turn of events, because this gentleman earlier in the day agreed to go to rehab, or agreed that he would be open to discussing going to rehab. And then the case management and social work team enter into the conversation and go to visit with him to talk about this. And apparently he was confused and delirious for some reason or the other. And when the physician the next day, okay, so that was on a Wednesday. The next day, we're discussing this patient, and I indicate my concerns clearly to the patient, and the physician looks at me and says, well, yesterday he refused to go to rehab. At that particular point, I attempted to provide some context as to why I thought he may be refusing, and the rationale was that he was apparently confused because he agreed to it earlier in the morning. For whatever reason, he was confused or altered for some reason, and he refused it in the afternoon. And the physician said, well, he refused, and we don't want to waste any more time trying to get him somewhere if he's just going to refuse. I attempted to advocate for the patient at that particular point, and what's more is that apparently the family had come in the interim time and had said, we're just going to take him home because he doesn't want to go to rehab. Well, they weren't aware that I was even seeing the patient as the therapist. The family said, we just want to take him home. The physician indicated that, well, they want to take him home. He's refusing. We don't want to waste any more time. We're going to discharge him. And not so short story long, if you will, he ends up discharging that day. So less than 24 hours after I see him, he discharges home. He's not home for more than 18 hours, and he is readmitted to the hospital. This just happened. And the reason why is because he got home and realized that he couldn't take care of himself. The family realized how much help he needed to mobilize, and they brought him back to the hospital. Now, this gentleman should never have gone home in the first place. This gentleman should have been given the benefit of the doubt and have been followed up with again about his decision to refuse when he was in a more clear state of mind. So I go and do his assessment again today at this readmission, and I ask him, Mr. So-and-so, do you remember refusing to go to rehab? And he said, son, I barely remember being here the first time. I don't remember refusing rehab. And I simply looked at him and I said, I thought not. I said, I recommended that you explore other options other than home at your last admission. And he said, well, that's apparent to me now. I need to go somewhere. I'm not strong enough to be at home by myself. And that's the end of that story, guys. And quite frankly, that is uncalled for. When you have a member of the care team requesting a physician to reconsider discharging someone home, given the clinical and objective data that is happening in real time, or that took place in real time. It's obvious, and I hope it's obvious recounting this story to you guys, that something took place. Maybe this gentleman has some sort of history of dementia that wasn't elucidated in his medical history. We didn't even explore those options. We did not give him the benefit of the doubt and follow up with him to ensure a safe discharge plan. We simply took him at his word that he was in a confused state, that he wanted to go home and he was going to refuse rehab, when he indicated at an earlier date, when he was more lucid, that he would consider going to rehab. But no, we caught him in an altered state and took that refusal as being the request on which to act. And as a result, this gentleman went home, and we're lucky that he didn't fall at home. And he certainly is lucky. He could have went home, tried to get up and go to the bathroom, tried to get up and do anything else in his current impaired state, and fallen again and exacerbated the cervical fracture in his neck, broken something else, had a brain bleed. Any number of unfortunate realities could have taken place because we wanted to, because the hospital wanted to push this discharge so quickly and not consider the entirety of the situation that was going on. And so advocate for your loved ones, be present when they're in the hospital, get the appropriate information, ask the hard questions. And that's part of this video series that I'm doing, is to help you guys be aware of situations like this and be armed with the information to advocate for either yourself or your loved one before an unsafe discharge plan is acted upon. And if I'm just going to be frank, this discharge plan that was developed was very unsafe, and the patient's very fortunate that he didn't go home and have a significant life-altering event happen again. So advocate for your loved ones, guys. If you want more content like this, follow me. I'm Jeremy. I'm with the Hospital PT. Guys, I'm just trying to help. I'm trying to help put information out there, bring awareness to some of these issues, because, guys, our healthcare system is not what it once was. Healthcare staffing are stretched thin. Hospital staff are stretched thin, and it's showing. It's very apparent to me. So I'm trying to do what I can to raise awareness, to give you guys the tools to help yourself or your loved one, if you find yourself in the hospital. So stay tuned for more. Hope you guys found this helpful. And this gentleman now has a good discharge plan in place. That's ultimately how it ended. We were able to get him, work on getting him placed at a post-acute facility so that he can work on getting stronger again. So you guys take care, and until next time, we'll see you later. Take care.